So, you've hit week 13 of your pregnancy. First off, a huge congratulations. You've just crossed a major threshold. This week kicks off your second trimester, and it's a time of some truly incredible changes for both you and your baby. In this explainer, we're going to walk through everything you need to know about this pivotal week.
Okay, so first things first. Take a nice deep breath. You've officially walked into what so many people call the safer phase of pregnancy. That really delicate, high-risk period of development is behind you, and a brand new, exciting chapter is just getting started.
You've probably been holding on to this incredible secret for, 3 months now? Well, because you're in the second trimester, a lot of people feel like this is the perfect time to start sharing the news with friends, family, and a wider circle. And this is the number that brings so much peace of mind. Check this out, 1%. After week 12, the risk of miscarriage just plummets, all the way down to just 1%. And that, right there, is a huge reason why so many parents-to-be feel confident enough to start sharing their big news. Okay, now for the really cool part. What's actually happening with your baby? They are making some of their biggest developmental leaps yet this week. The growth is just mind-blowing, so let's take a closer look.
I mean, just look at this. This 3D scan shows your baby is starting to look so much more like, well, a little person. Those arms and legs, they're fully formed now and finally look proportional to the rest of the body. They're not just tiny little buds anymore.
And the detail here is just wow. If you look down at the feet, those toes that were once kind of webbed are now totally separate. And the ankle joints, they're developed enough to actually work, which means they're getting ready for all those kicks you'll be feeling later on.
And you know where all this movement is coming from? The control center. The forehead is high and kind of bulging right now because the brain inside is developing at an absolutely incredible rate. That's what's powering all these new, more coordinated movements.
So let's just recap the big highlights for your baby this week. All the joints are formed, which means a full range of motion is possible. The two halves of the brain, the hemispheres, are starting to connect. The eyes have moved from the sides of the head right to the front. And those little toes? They're separate and distinct. And all this is happening while they're just floating and wiggling around in about 25 milliliters of amniotic fluid. Amazing, right? All right, but it's not just about the baby, is it? Your body is going through some major shifts too, and that can bring on some new sensations. But don't you worry, we've got some creative ways to help you stay comfortable.
Does this look a little familiar? Are your favorite jeans starting to feel just a bit snug? You're not alone. But you're probably not quite ready for maternity pants yet, so here's a time-tested classic trick. Just loop a rubber band through the buttonhole and then wrap it around the button. It's such a simple little hack to buy yourself a few more weeks of wear.
Okay, you might also start feeling these sharp, kind of sudden twinges in your lower belly or groin area. And look, it can be a little alarming at first, but this is most likely just round ligament pain. Seriously, think of it like growing pains. As your uterus gets bigger, the ligaments holding it up have to stretch out, and that's the feeling. It's a super normal part of pregnancy. Okay, let's shift gears for a minute to a more serious but really important topic for this stage of your pregnancy: genetic testing. After some of the initial screening tests, you might be faced with some decisions about what are called diagnostic tests, and it's so crucial to understand what your options are. So what exactly are we talking about? Well, screening tests just tell you about risk. Diagnostic tests, on the other hand, are designed to give you a definitive yes or no answer. And they do that by taking a direct sample of cells, either from the placenta or the amniotic fluid, to get a clear look at the baby's chromosomes. One of your main options is something called chorionic villus sampling, or CVS for short. You can see in these diagrams how it works. A doctor takes a really tiny sample of the placenta, which, by the way, has the same genetic material as the baby, and they can do this in two ways, either with a needle through the abdomen or with a thin tube, a catheter, through the cervix. It just depends on where the placenta is. The other common diagnostic test is amniocentesis. For this one, a very thin needle is inserted through your abdomen into the uterus to collect a small amount of amniotic fluid. That fluid actually contains cells that the baby has shed. Those cells are then grown in a lab and analyzed. This table really helps break down the key differences. So the first thing you'll notice is the timing. CVS can be done much earlier in the pregnancy, but amniocentesis, which happens later, can also test for neural tube defects, like spina bifida, which CVS doesn't. Now, both tests are highly accurate, and it's really important to know that they both carry a similar, very small risk of miscarriage. We're talking about 1 in 400. Okay, so if you do have one of these procedures, it's totally normal to feel some cramping afterward. But you absolutely need to call your doctor right away if you experience any of these more serious symptoms. Think of this as your checklist for what to watch for. It's all about making sure you stay safe.
All right, let's move on to something a little lighter, how you can feel your absolute best during this trimester. Hopefully, some of that early pregnancy nausea is starting to fade away, which makes this the perfect time to focus on nourishing your body and staying active in a safe way.
So your appetite is probably coming back with a vengeance, right? But this isn't exactly a free pass to eat for two. In the second trimester, the general recommendation is somewhere between 2,100 and 2,500 calories a day. The real focus should be on nutrient-dense foods, not just empty calories.
Feeling tired? Yeah, that pregnancy fatigue is real. But you can fight back with iron, so try to load up on things like dark leafy greens, spinach, kale, red meat, and legumes. And here's a pro tip for you. Always try to pair your iron-rich foods with a source of vitamin C, like a glass of orange juice. It dramatically boosts how much of that iron your body can actually absorb.
And what about exercise? Definitely keep moving. But your center of gravity is starting to shift, so it's time to press pause on certain activities. The main thing here is to avoid anything with a high risk of falling, so that means things like skiing, horseback riding are out for now. You also want to avoid stuff with sudden, quick turns. It's really all about safety first.
And finally, as we look past week 13, let's remember what's happening beyond all the medical stuff and the physical symptoms. This is really a time when that emotional connection to your baby starts to get so much deeper.
I just love this line from our source material. Even though you can't feel those little kicks and flutters just yet, you can absolutely start bonding. Talk to your baby, sing to them, play music, or just take a few quiet moments to think about them. Pretty soon, your baby will be able to hear your voice, and this is where that incredible relationship really begins.
The second trimester is such a journey of incredible growth and change. It's a time of relief, excitement, and brand new connections. So that leaves us with one final thought to ponder. As you step into this new, more confident chapter of your pregnancy, what are the small things you'll do to start building that lifelong bond with your little one?